Good evening and welcome to the Human Services Committee meeting. Is there anybody that wishes to speak to courtesy of the floor? Hearing no one, we have an update from Area Agency on Aging.
Hi, good evening. I'm Lori Stantonlini. I was here last year. I think I met everyone. Sue had told me that at the last meeting, someone had asked about the Lanta rides for the senior center. So we currently provide sponsorships for 90 consumers to go to and from the senior centers. Since January of 2025, we've provided 11,102 rides so far. Currently, with this state budget impasse, we have a wait list for our services. Our options program, which provides in-home services such as personal care, Meals on Wheels, emergency alert buttons. We started the wait list in May, and we currently have 105 people on that wait list waiting for service. Our caregiver support program, that is a program for caregivers of not only older adults, but also grandparents for children. And we have 4 people on that wait list. We just implemented that a few months ago, maybe 2 months ago. We are not starting our emergency fuel plan November 1st. Well, we didn't start it because one of the criteria for our people to be eligible is they have to apply for LIHEAP, exhaust that fund, and or be ineligible, and LIHEAP pushed back their start date to December 3rd. So we will relook at that. The other thing I wanted to bring up was the farmer market nutritional program. We did really well with distributions this year. We distributed 2,469 consumers. Each of them received 5 vouchers. They were $5 each, which was a total of $25 per consumer. That did decrease from $50 per consumer during COVID. We had extra money for that program through the American Rescue Act. And that's pretty much it. Do you have any questions for me about aging?
I think I did. I wanted to know how you were doing with staffing, also with, the word will come to me, protective services. How are you dealing with protective services?
Yeah, that unit is down right now in workers. We had some retirees and people left. However, we've been implementing for the past year to train other workers, their ACM2 positions in protective services as backup, and that's working out really well. They're helping with doing the face-to-face visits because the volume is high. We did hire 2 people, so one had started and one will be coming on, and we have, I think, 2 positions that just came down, postings. So I'm hopeful.
I don't even know how to ask this question, but I'm going to try. So obviously, it looks like you're making some adjustments and some contingencies. With the absence of the current funding, do you have any kind of plans that you're looking forward in case this continues? Like, right now, it seems like you've implemented some stopgap measures, but what if we keep going? I know that's like a,
Yes.
but we need to know how we're going to be able to help and support you as well, and where your need is, because I think people need to understand what's at stake as well. And that's not to say that you aren't doing your job, but how can we help advocate and support if we don't know what that is?
You can expand on it then. I think that you all have heard the county executive talk before about the fact that if we don't have a state budget before this year even, the county can't raise enough money to provide human services, right? Our budget is $260 million. Yes, that includes Grace Hill at about 90 million. And so, in all honesty, I think the short answer is that without a state budget in the new year, we're just going to have more of the same, which is more wait lists, more the inability to serve people will continue to grow is the short answer to that. So without a state budget, there are no contingency plans for where that amount of money would come from. So I don't know if you had something more specific in mind in your question, but
Well, I wanted to start there.
Sure.
So I think the next part is, what are we, and I asked somebody else this question too to get it different, what are we statutorily obligated, must provide? Like,
So
obviously, if
for-
somebody's not in the program, we don't have to guarantee to take, but what about those that are in?
And protective services is definitely a mandated service. And I think the issue that will come to a head if there's not a new a budget in the new year is what the county's response is going to be to a state who statutorily requires things of us and doesn't provide funding. Because it's just not realistic. There's just not enough money to bail all of these things out. So in the short term, protective services will always be that will always take priority, right? And so if everything else went by the wayside, this is all a theoretical conversation.
And that's on,
That would have to stay in place. And so, but would it stay in place a year without a state budget? I can't answer that.
no, and I would hope that we're not at that point.
Agreed.
Hello?
Yes, sir.
I would like to ask a question. Hi, it's Ron.
Go
Hi,
ahead.
Ron.
I understand the situation that you're in, and I understand the entire process with the state, and Human Services essentially runs on the state funds and federal funds. But I guess the concern I have is, for example, we're going to have a new administration come January. I don't know if they're going to have their act cleaned up in Harrisburg or Washington for that. I don't think anybody knows. But we do have an obligation, at least for the most serious.
Lost you. Can't hear you. Ron, can you hear me?
Hello?
Go ahead, ask your question here, because can't hear a single word you were saying.
Yeah. I guess I don't understand how to talk.
No, it's not that, it's a, you know,
I know. It's the Zoom we don't understand. I get it. I've used it 100 times in other situations, but that's okay.
I know. But there, we missed everything you
no,
said, so if you want to repeat it.
I'm being sarcastic. Obviously. Here's the thing, if you can still hear me. I understand I agree with what was said. I mean, the state and the feds, if they don't give the money, Human Services is in big trouble. It's our lifeline. Having said that, can you hear me?
Yes, sir.
All right. Having said that, though, protective services is critical in all the areas of human services, including aging. And I think we have no choice but to figure out a plan, a workable plan, on how we're going to handle emergencies with the elderly abuse, or things like that. I mean, the schools don't get what they were supposed to get under law from the state, yet they've still got to teach children. The county, to me, this is why the contingency, the fund was set up. We have our contingency. The emergency fund was set up. We've got to start thinking about putting money in there, because this is probably going to be more common now that we've become governments much more partisan. I just want to know if there are any plans other than we just can't provide services going forward if there is no budget
So,
for emergencies.
sure. I mean, I don't have a solid answer to your question yet, Ron. The short answer is, you know, we're fine through the end of the year, right? I mean, that's the current projection. And, you know, into early in the new year. I think the county executive has talked about Ms. Zirinsky's willingness to take out a loan. How far that would get us, obviously, I have no idea. And I couldn't tell you off the top of my head what it costs to run protective services. So I think that the answer is certainly, even if nothing came to fruition with the budget, protective services is going to be the last thing that's not completed. So
Yeah. All
I
right.
think that for the next, you know, 4 months, we're okay there. And obviously, if the budget is not passed within that time frame, the problems will only be far worse than I can even imagine at this point.
And
I agree with you. I didn't go through a shutdown that went as long as these shutdowns are going, but I hear you, and I get it. And as far, you know, the county executive has his plan, but human service, there are other areas of the government, county. I know somebody's talking, and it's picking it up, so I'm sorry. The thing is, we may have to look at taking money from other areas that are not mandated, as we are in human services, and move it around, because you're going to have a new executive in January, to those areas that the county is there to provide. And you can't make a plan right now other than, well, here's what we can do as of January. Things change. Mr. McClure won't be there in January. I won't be there in January, much to the relief of many. But the thing is, we've got to work on something somehow with council, with contingency, some way that we've got to do whatever we can for human services. It is required. It is necessary. This isn't something we like to do, something we feel like we want to do. This is something we must do to the best of our ability. And as the judge told me once, when they wanted a certain psychological report done, and I said, well, we don't really have that in the budget. He said, that's not my problem. So I'm just putting that out there, that I think we have to think long and hard. I hope it doesn't extend, but you know, that's all I'm saying. And I know you're in a bind. I appreciate that. I'm just, you know, giving you my thoughts. Thank you.
No, I appreciate that. I think part of the problem is that, you know, aging protective services is mandated, child protective services and general protective services is mandated in children and youth, early intervention's a mandated service. I mean, that's the issue, right, is, you know, for now we are okay. And at some point, decisions might have to be made, but
Lori,
we're not
am I
there
on
yet.
that? What are you doing?
I was trying to mute you, so I didn't hear you, but apparently my mute doesn't work on you. So go ahead.
Tell me when to mute,
It
and I'll
mutes
mute
you.
myself.
Well, mute yourself now so Sue can finish what she's saying, and I think Ms. King would like to speak also.
I'd be glad to. I'd be glad to. Much like the budget, we're still waiting on a system that works here, but hopefully no one has any disabilities going forward, and everybody can show up, and we don't have to worry about technology going forward. But I will be muted. I am muted.
I just wanted to also add, like, we are in a crisis, and you know, the Child Protective Services, the Department of Aging, but Bucks County School District is looking at actually closing at the end of January. I pulled up the article here, and the superintendent says that this closure will include all in-person virtual instruction, transportation, food service, athletics, arts, and support services are going to close. Like, it is the law that we educate our children. And we are at this crisis now where we're going to start closing schools if it continues. So I don't know what the answer is, but it's not just our county services. We're looking at schools closing next. And we're in trouble if this continues.
Agreed.
Wait, hold on, I have to pull this. My other question was, and it came to me, the senior centers are, and I'll get back to this, but how are we doing with the senior centers? And are they having to close services? Are we fine with those?
I'll let Lori tell you about the senior centers briefly,
Then
but
you could stay, and we could continue the rest of
Yep.
the conversation.
Yeah,
But
if
I
you
don't
wanted
want
to
to
sit up
forget
here
it
too.
while she was here.
I won't let her leave yet. I just knew it was more a question for me for the budget, but senior centers, we do not anticipate having to make any changes this calendar year. If the budget is still not passed in January or February, I think I've mentioned here before, the state requires us to have one senior center in the county. I think I just talked about this at our budget hearing. We have 11. And so, yes, if a budget is not passed, we will have to make some significant changes there in the short term. We're trying to avoid that at all costs for so many reasons. Obviously, the seniors who attend being the first and foremost. But the other issue is, it's something that, could save us money now if we closed some of them. But if we're going to reopen them in a month, it doesn't make sense to,
Right, right.
save pennies for the short term. So we're not making any changes at the moment.
So how those work, are those sort of geographically
I'll let Lori answer.
located to be amenable to folks in different areas in the county?
They are.
How's this, like, the census spread among those 11? Like, are they filled, or are they?
So Slate Belt, which is the only one up in the Slate Belt area, gets a high attendance, as well as Park Plaza. There are our bigger ones. We do have 11, however, for our contracted, we don't run them. We do provide some funding. I do know that the Hispanic Center gets a high attendance. The Nazareth's, I think it's Lower Nazareth, has a smaller attendance at that. There are 2 in Nazareth.
Are they required to get their own transportation there, or some of the land to transport?
Some of the, yes, the land to transports are for them. Some people drive. Some of the centers are, like Rooney is right in a building where people live, so some just walk there, go downstairs.
So far, so good.
Yes.
How about, like, food insecurity? I mean, do we have issues with seniors reporting food insecurity?
Yes.
I'm hearing my consumers saying things like that, and
We do
and I think
have-
it's a little panicky since SNAP just kind of closed, but I think, like, just the anxiety about I'm not going to have it, I'm hearing louder, and so I'm just wondering what kind of reports you're getting.
usually keep a pantry with stocked shelf-stable food. We purchased some extra little actually from Meals on Wheels, we purchased extras of those last fiscal year. So we've been handing those out to anyone that's food insecure.
Do you have a way for people to donate to your pantry if they so choose, or is that
We
public
do,
information that we could give out, or?
we don't have that big of.
No, I think the problem is I love the idea, hadn't thought about it, but the pantry is like the hallway at the DHS building. So we're calling it a pantry, but it's literally just piles of boxes, like in the hallway or in an office that we wouldn't have room if we opened that up for.
I started throwing turkeys at you next week. Place to put them.
No, but you know what? It's Children and Youth works with this church who every Thanksgiving and Easter, I feel like, and Christmas, there might be a fourth one in there, they provide a basket or a box with, the turkey, the side dishes, milk, bread, and so if you have a family that you're working with anywhere in DHS, you can request one of these boxes. So there are things that we do with the community. That's obviously, we get them in the morning and we deliver them that day. So again, the problem is really just a storage issue of making it a public request. But I'm sure if folks want to donate to their food banks, that would be great.
Yes, Ron, I'm using my microphone, sorry. And maybe that was for you too, I don't know, once again. Bless you. Again, I'm just back to these mandates, and I'm not asking this to put you on the spot in any way, shape, or form. I've been asking everybody. We had a regional meeting at CCAP last week, and we talked about it, and our new director is going to work on trying to identify what we as counties must versus don't have to. And I understand morally we should do it all, but maybe there are some little things we can cut and other things we could shift responsibility to. But if there's, when we're in human services, I've had to be a rainy day thinker since the day I came to this field a long time ago. And we've had good years and we've had bad years. And so if there's ways that we need to help you collaborate or put out the word or ask for donations or volunteer, what about people if they want to volunteer? Obviously they can't volunteer to do protective services, but some of these other kinds of things that we can do for seniors, is there a way to have volunteer recruitment, or do you have that?
We do at the senior centers. There's also an organization called Share Care, and they're actually going to be at the different senior centers trying to recruit volunteers. They provide services such as taking people to the grocery store, just a senior companion type service. So I know that they're currently looking for volunteers.
Do they have to go in any kind of training or fingerprinting or any of that kind of stuff?
I'm not sure. I would imagine so, but
You can get that back to us. We could put it out, I think.
we have a flyer we can send Daily.
Anyone ask questions? I'm sorry I'm usurping, but and I'm just glad you're here. I mean, this program, I think, I could look at Sue and honestly say, when we first got here 8 years ago, were you here 8 years ago? But not. It was rough,
not
right?
in this role.
Not in this
Yeah, it was
No, I
rough.
remember. We know who was in this role and they're not here, but it was rough. And so this department has come beyond, and it's wonderful, and we just want to do anything we can to support you. And these are the folks, I can't even believe, okay, we're going to wait on LIHEAP. It was cold this weekend. It's really cold. And so, whatever we could do to help support Great Links.
Thank
I
you.
like Ron's idea. We could take some money from somewhere else and put it toward what we need to do. I'm willing to do that. Anyone else have questions? Or?
Yeah, so the 105 seniors on the wait list, so if the money came in tomorrow, when is the time to get those 105 seniors the services they need?
Well, we would have to reevaluate where we were financially. The Pennsylvania Department of Aging has guidelines. So on that wait list are individuals who are waiting for in-home meals, personal care, and adult daycare. According to our regulations, all of the in-home meals would have to be removed from the wait list first. And then the second is adult day services, then personal care. So we would have to look at what that would cost. For the meals, we would have to remove all of the people who are on the wait list for a meal, for the in-home meals, before we could move on to the next service. So for instance, if someone's on our wait list for personal care and in-home meal, they might get the meals first, but still have to wait for the personal care.
Can I clarify one? Oh, not
Oh, sure.
Part of the reason for the wait list, going back as far as it does for personal care, is not solely a funding issue, but a provider issue. So we do not have enough providers who do in-home services, like helping with like tasks of daily living. And Lori and her folks did put out an RFP. Was that earlier this year or last year? Sometime in the last, okay. And still, we do not have enough providers, and the providers that we have don't have enough staff. So even if all the money came in, there'll still be some people on that list for that reason.
What's good? What's working?
What's good?
No, again, pretend we're not in a budget
I'm
crisis.
still standing.
Because seriously, like, I feel horrible that we're finally seeing you at this point in time where if we had you in May, pre all this, maybe we'd be having a different conversation. So if we could turn back the clock and pretend that we weren't in a crisis, what's going well in your department and what are you happy about? Because we should hear that and we should
We have an
celebrate.
amazing team in aging. I tell that to Sue all the time. Our supervisors go above and beyond. At any given time, we're chipping in, usually for protective service, because that takes precedence over everything. The aging care managers, too, have been adding to their job duties to go out and ensure that the older adults in Northampton County are safe. And that's, at the end of the day, that's good enough for me, that we're seeing everyone and
Thank you for coming.
thank you
Whatever
for
we could do
having
to
me.
help. I mean, I feel that way about the early end and this end. I think it's important that we figure out ways to support you.
Thank you.
Ron, any last words? Ron?
I'm here. I don't really have any last words. I mean, I didn't really get much of anything because it's like a whisper. So I don't know, but good luck. I hope everything goes well. And I think we do have to have contingency plans for human services going forward. It's critical, other than to say, well, it's somebody else's problem. I mean, we in Northampton County, forget what anybody else does. The county of Northampton independently has to think about what we're going to do. But I won't be able to hear the response, so that's all I have to
Well,
say.
you might, you know.
Yeah, right.
Well, here, Aileen wanted you to call in, but do you know the call-in number? Do you have the old call-in number, Ron?
Lori,
Yes?
I'm going to listen. I'll give you my question, and I'll just listen to the answer.
Sounds good
Don't
to
worry
me.
about it.
Sounds good, thank you. Well, I'm gonna do it this way. Thank you. Yeah, why doesn't she do that? If that helps him, because this was not expected. Okay, next we have update from Graysdale.
Hello. So we're going to start off with our census review. We have 501 residents right now. Our goal remains 520, and we have steadily increased this year. Our nursing home PPD, which is our nursing hours per patient day, in September was 3.2. The next page, I want to clarify a little bit. So it has our admissions and our readmissions, so our total in, our discharges and deaths, and our total out. So it makes it look like there's a net loss of -6, but that's because some of the readmissions, it could be the same person counted more than once, like if they go out and come back and go out and come back. So what's more important is the yearly number, which is the 501, which is an increase.
Can I go back to that? I think we did this the other day, but just to clarify, of that 501, how many are short-term rehab in the census? Or you're not including those numbers?
That's our total census right now, so that is short-term and long-term.
So what's the difference between, how many short-term and how many
I actually didn't look up the number for today because that varies frequently. So we've been averaging between 5 and 10.
in short-term?
Our goal is we want 20.
And length of stay for that is usually how long?
That varies too, depending on the resident. And there's always a balance between, providing the right amount that they need, but not overutilizing. And that's part of an important part of our partnership with the hospitals, because they kind of get graded on the whole spectrum of the utilization, not just their utilization, but ours as well. So it's kind of finding that balance. Usually a couple weeks is a good balance, but it depends. Some residents might come in for something that's more complicated than another. So it really depends on the resident's condition and needs.
Yeah, so that's diagnostic and recovery-based and not like any kind
Correct.
of QR thing technically?
There are some things like for accountable care organizations, they usually have a target goal depending on the diagnosis. But again, it can be individualized by the patient's, comorbidities and what's going on with them.
Sorry to interrupt, I just want to break.
That's fine. Hospitalizations, we're doing very well there. Our numbers are dropping, and what I would like to point out there is that with one of our ACOs, we're actually getting a performance payment for keeping rehospitalizations low. So we'll be receiving $11,000 for good performance.
So what are the kinds of things that people go out for? I mean, obviously,
It could be.
severe conditions that can't be managed.
Yeah,
there, but-
obviously, if it's a clear emergency, they're going to go out. So one of the things we always look at for reducing hospitalizations is making sure that the on-call providers are getting good information and training the staff to really remind those on-call providers of what we can do in-house. So that's been something we've been looking at closely. The on-call provider many times is not someone who knows the resident. It's just someone who's filling in on call. And with the telehealth, sometimes it's not even someone interstate. They might be in another state somewhere. So they're relying on doing the video call with our nurse and our resident, trying to assess that way, looking at the chart, what information we give them. So the better the information we give them, plus that reminder of what we can do in-house and what the time frame to get it done in-house would take, then the provider could make a good judgment of, okay, can that person safely stay at Graysdale and get the care needed, or do they need to go out? So the need to go out could depend on, okay, it's not something we can do in-house, or if the time to do it in-house versus the time that an ER could get it done. Some people you can say, well, yeah, it's safe to wait that time. Other people you might say that time frame's not safe enough for that person, let's send them out.
In terms of hospitalizations, they're not just medical, correct? Are some of them mental health based?
Some are mental health based, yes.
Do you have, again, a breakdown of the disparity?
No, I would
of
have to go back to our electronic health record and break it down. But if you want that, I can get that to you.
It would be interesting just to
Yeah.
hear, because I realize you're dealing with an increase of those kinds of issues as well. And I would want to hope that the mental health is less, but I would probably be wrong. So let's just
Yeah, it does happen.
start the pool now and we'll get the data later. How's that?
Okay.
I have a quick question. I noticed that in a couple months, you're going to have the lowest fall rate you've had in 2 years.
Yeah, I'm going to talk about the fall rate in a minute.
Okay,
Yep.
okay.
Yep.
Sorry.
Yeah. So after the hospitalizations, our fall rate has been decreasing. And what's I think I'm really proud of, and our team is really proud of, is we had identified that on Tower 9, they were having more falls than any of the other units. They were at 40 back in May. So we formed a performance improvement committee. And one of the things that I focused on with our team, with the performance improvement committee, is we need to get the people who are closest to the problem onto that committee. And a big piece of that is, part of it is the buy-in, and I think that's why we're having this success that we're having. If we just put it out as a directive, then a staff response could frequently be like, oh, here's another thing that they want us to do. So getting them involved and in a no blame type of environment, saying, hey guys, look, we're having this problem. We had 40 falls on this unit. The other units had a lot less. What do you think is happening? What's causing that, those falls? So getting them involved in doing that root cause analysis where they're part of thinking, hey, why are we having this problem again, versus saying, blaming them. That has made a huge difference. So to date, their falls for September have been down to 10, and they've been steadily decreasing, and they're at 10. And the things that they're implementing is we've really been looking at the environment and how are we getting those residents engaged and keeping them occupied under supervision, that kind of thing, and getting staff input into how do we do that. So I've been really proud of that team. We have a housekeeper, a CNA, the restorative aide, the nurse, some of our leadership team all involved in that committee. And I think that teamwork, and again, getting that buy-in because they're part of the solution, like they've really taken ownership of it. They've done a fabulous job with it. And we've really been approaching it as a sense that, okay, the residents, your unit, how do we support you in finding a solution? So that's really how we've geared that they come up with the ideas and then we figure out how do we make it work, and that is implementing their ideas. So we're really excited about it.
What were some of those things? I mean,
Ron.
like, as a nurse, that's the scariest thing of all. Like, you're staring at your patient and like, please don't get up and fall.
Yeah, and we want them
Yeah.
to remain mobile, and we don't want to constantly say sit down,
Right.
because then they start losing their abilities. So we looked at, okay, why are they walking? Encouraging people to walk. So instead of saying sit down, it's come on, take a walk. We've ordered some different equipment. So for example, we started thinking about a lot of them leave their walkers behind. And some of the reasons for that are if someone has dementia and they've never used a walker before, now how do you suddenly expect them to learn how to use a walker? So they don't remember that they have a walker or how to use it. Or, it's one thing to use a walker in a big wide open space, but then what if you're in an area where there's a lot of other things around? There's other residents around, other equipment, staff, that kind of thing. So sometimes they can't process moving in that type of environment. So one of the things we thought about, okay, what is there that they would walk around with that's something more natural that they've done for years? So two things we did is we bought an item that's a shopping cart, because how long have we all been using shopping carts? For years, going to the grocery store, and a stroller. And that also has more of a handle versus a walker's type of handles. Like they're used to having that kind of horizontal handle versus two handles. So we thought that mimicked something that was more familiar. We bought some baby dolls because some residents respond to that. We're also looking at the environment and making sure that we're having some rest areas that are soothing for people to sit down and rest. And one of the things we found with looking at our fallers and doing a more deep dive into why they're falling, we were finding that some of our residents who were falling were because they're residents that because of their dementia don't always realize that they're tired. So they keep moving till they're so tired that they fall because they're exhausted because they don't sit down during the day. And then they might not be sleeping at night. So some of it has been just the communication from shift to shift, that we're making sure night shift is telling day shift, like, hey, residents A, B, and C have been up during the night, so they're probably more tired. And then the day shift will focus more attention on residents A, B, and C to make sure that they're getting some rest breaks. So it's been all kinds of things like that, and we're happy to say it's working. So we want to start taking that, what we've done, to the other units too, and say, okay, here's what we learned from these units. What can we carry over to another unit? And I think a big piece of the success is that I believe we've tried PIPs before, but as you know, Graysdale is very large. With 500 residents and all the different units, you can't do a performance improvement project on the whole community all at once, because it's too big. So it's like, okay, what we need to do is more pilot projects where we pick an area, say, okay, let's focus on that area, let's try some things, see what works. Then when we have some things to work, then carry it to another area and then another. So it's a more systematic approach. If it's too large, you can't succeed all at once. It has to be broken down.
Ron, did you have a question, or could she keep going?
I have a question.
Yes?
Can you hear me?
Yes?
I called in on, Jen gave me the call-in numbers, good old reliable phone, to use rather than Zoom, our Zoom at least. Can you hear me?
Yes.
Yes?
Okay, I'm sorry. I could barely hear anybody there. But nonetheless, and my phone is charged up. Nonetheless, I have a question. It's just a basic question. And I never had a chance to meet the director. I had planned to go out, but then life got in the way and changed my plans. But anyway, it is a difficult job. There's no question about it. But I remember the meeting where you said, Director, that you were looking at everything to get yourself familiar and to see what's going on out there. But when asked if you had looked at the affinity report from the folks that came out and studied it, you said no. And I was just always curious, why didn't you read that report?
I don't have that report. So I'll have to, and I haven't honestly with the day-to-day that we're doing. And, I've been concerned with, okay, what is happening right now? Because any report is a snapshot of that moment in time. So, reading that report, I would still need to look at what are we doing now, because is it the same as it was at that time? And we had a lot of things that we just jumped right in as a team to say, okay, we know that here's some problems we have right now that we have to take care of. And I think the falls are a great example of that. 40 falls on one neighborhood is way too many. And we'll
let me
never
just
prevent
keep-
every fall, but, trying to say, hey, here's some hot topics that was a priority.
All right, let me clarify. I understand. I've been involved in human services for some time. Let me be clear. I do not say that some report, and I don't even remember how many pages it is, takes precedence over the day-to-day operations and the things that come up. But I'm not there physically most of the time now, but I do listen to the meetings, even if I'm not participating. And when you came in, it just struck me that you said, I'm looking at all the information that's been given to me. First of all, I'm sorry you didn't get the affinity report. The taxpayers paid good money for that. And for some reason, I don't know why, it wasn't given to you. It may be a snapshot in time, but just about everything we do is a snapshot in time when it comes to information. I just thought it might be helpful, and I was just curious as to why. But you said you didn't have it. We can certainly supply you a copy. At some point, you may have the time. It's not a long one, but it does look at an overall holistic view of operations, and it might be helpful. I know the administration did not like the report, nor did they like our pay study, but that's neither here nor there. This is about Grayscale, not somebody's opinion. But, that's just, you've answered, and I understand. So thank you.
Mr. Heckman, ooh, Jesus, now that's loud, sorry.
Wants it
I know
loud.
you want it to be louder. It's Sue. That really was just an oversight or not on the top of my mind, but I will absolutely get that to Michelle. And I have not looked at that report in some time, although I did earlier this year. And if I recollect correctly, that report was largely positive on Graysdale. So I'm not sure that I'm sure there was a couple of things we disagreed with or didn't love, but my recollection was that the report was largely positive. So I do think it would be helpful for Michelle to take a look at. I think it would be validating that some of the things that she and her team are doing are things that may have been in there to be addressed, and it will be a good comparison also to see, how much further we've come even since that time. So that's not on Michelle, that is on me, and I will make sure I get that to her.
Well, yeah, let me, if I may, Madam President. I'm not, sometimes I feel like if I ask a question, and it's an investigative question, there's a need to come up and do some PR. I'm not saying that nobody's doing a great job, and the report didn't say you guys were doing a great job, or you're already doing a great job. And I mean, it's just, I get that, and we hear that a lot. Everybody's doing a great job, but the thing is, we all can benefit from information. And if the information is, hey, you guys are doing a great job, don't change anything, then that's the information. Or if it's, hey, you know what, there's a mop in the stairwell and we could get cited for that. Okay, that's not a big deal, but it's information. And so, I mean, I think it's been difficult because so many questions I answered with a preface of, this administration is doing this wonderful. It's said we're great. All right, I get that. I get that. But it misses the point sometimes of the question itself, which is, did you read the report? Now, you said you didn't get it to her. Okay, fine. I was just curious because, again, it's one more tool, and it may be a lousy tool, but it's a tool, and whether it's positive or negative, it doesn't matter to me. It's just a tool that you decide if, in fact, it's worthwhile. But I mean, I was just taken aback by the answer. Nursing homes are the most difficult thing to manage, to run. I've said they're more difficult than hospitals, and anything that can come across can be helpful. Yeah, so I didn't mean anything by that other than the report. I'm finished.
Yeah, I do agree it's a tool, but as I said, it's just that we had some clear items that we needed to work on, so we already had a great starting place of things that needed to be done immediately. And then our strategic plan, and part of our strategic plan is similar as far as the affinity report, because one of the things that was really important to us was getting our leadership team involved in, doing the SWOT analysis to develop our strategic plan. So at that point, that was really helpful too, to talk to the people that have been there. And that was important not just for our strategic plan, but I think from my perspective as the leader, to showing our team that their input was valuable, and, me not just coming in and saying, hey, we're doing this without getting their input and getting, again, their involvement, just like we did with the Falls Committee. So on our strategic plan update, we are working on our staffing still. The Talavera rollout is going well. We're now prepping for the master service provider agreement. We do have a team engagement committee that meets monthly. So what we're currently doing is we completed our staff satisfaction survey. So we're tallying the results right now. So we will have the results next week. And my first step before I release that to anyone else will be to take it back to the committee, because the committee was instrumental. It's a group of team members, getting back to them with the results first. And then we'll be looking at, okay, any results that we think we can improve, working with the team to help plan that. We already talked about the Falls Committee, getting involved in the community. We did have our annual trick-or-treat event where the community was invited to bring children in, and that went really well. And we attended the Northampton County Festival. And we continue to work on our financial goals. So with increasing census, we're still keeping overtime low. We're still averaging in the 40-hour per pay of overtime for career services. So that's been huge because we started the year at 240 some. So we're keeping that down. And also at the Talavera, our cost for agency has dropped drastically. Our first week alone, we had saved $42,000. So we continue to do that as well as other lean operations so that we're managing well. Any other questions?
I just want
Go
to
ahead, I'm
say,
sorry.
I just want to say this is unbelievable. I mean, in the short amount of time that you've been here, how much you've done. In the last 4 years, our census is the highest it's been. Our falls in almost 2 years are the lowest they've been. And the weight loss is the last month of data that you have is one of the 3 best results in 2 years that you've had. And having this overtime remain low and the Talavera having good results, I can't say enough. Graysdale is our moral obligation. I mean, lots of people love to stomp all over it, but this report, it just gives me hope. It really does.
I want to give that recognition to our team because it is that leadership of our team together working cohesively. And it's not just our leadership team, like it starts with us. And we talk about that a lot, that it starts with us. And then when we get other people involved, like we do with the Falls Committee, like that sets a different tone. And so it is our team. And, you know, I have some of them right here. So we do have a great team, and I have a lot of confidence in our team.
Thank you. You guys have done a tremendous job, and I know how hard it is. I really do.
Thank you.
So who's part of that team? Like, who do you, when you keep referring to the team, it sounds like you have different groups that you're working with.
We do.
Of the overall,
Yeah, so it started with our leadership team, so our department heads. We had a department head meeting, as I mentioned, when we developed the SWOT analysis and then the strategic plan from there. So to me, that's always a good starting place for success because you need your leadership team to have that vision of here's where we are, but here's where we want to be and how are we going to get there. So I think it started with that. But then when you start getting other team members, like the line staff involved in things like the fall committee, that does send a message to them that their input is valuable. You know, it's one thing to say on paper, well, this is how we're going to solve it. Here's what we want you to do. You know, and it's not always realistic. Things that look good on paper don't always work in actuality. So when you get the people who are actually doing the work to say, hey, you know, what do you think is wrong and what do you think we can do to improve it? So that is another team. So, you know, stretching things out that way that we are getting people involved. And that gives people the buy-in into what we're doing. When you get them involved and they know that they matter at work. You know, the staff engagement committee is another one. I have a variety of team members from different departments and different levels involved in that committee. So we have a housekeeper on that committee, we have CNAs on that committee, we have people from staff development, people from admissions and marketing, they're on that committee. We have an interdisciplinary committee for our marketing team. So it's really pulling people together. And one thing I've focused on is, you know, meetings. No one likes to sit in a meeting. So one of our rules is a meeting needs to be no more than an hour because we want to stay on track with business. So we need to keep the meetings short. And we try to focus the meetings on things that need a discussion and that are action-oriented. Because if it's something that's just an FYI, I don't need to waste everyone's time sitting around listening to data if we're not doing a discussion of what are we going to do about it. So whatever type of meeting it is, if it's just an FYI type of thing, we're trying to pass that out. We do a weekly update now. So if there's anything that any department wants to share with another department, and it's not even necessarily that they need to know that information, it's that it's nice to know so that you feel included in the whole community. So those we send out as a weekly FYI. So if it's just like, hey guys, here's what my department's been working on. So we don't need to sit time in a meeting for that. And that also tries to help cut down even our emails because we get an awful lot of emails. So this way, if it's an FYI thing, you don't get 20 different emails from 20 different departments. It's all in one email. So you only have one email to look at and read. And if you want to check back on it later, you don't have to search among 20 different emails, it's like, okay, the weekly update, I only need to open one email. So, I mean, we still get way too many emails, but it's one way to help cut it down and make it more manageable.
I have to say the buy-in's really important with asking people their input so that they feel like they're participating. But the other part of this is the results from here, that you are protecting these people, you're doing a good job with these people, and your results are so great that you can be proud of that. And so that's the other part of employee satisfaction, is knowing that you've done a great job and getting recognized for it. And I'm here to tell you that this is a great job, and I really hope that we start hearing more positive things.
Thank you. We would like that.
Yeah, because I'm sure that all the negative things that we've heard this year, and we've heard them, that they just bring you down. And you go to work and you're like, you know, you read the paper after a meeting or whatever, and you're like, gee, what am I doing? So, great job. I'm really impressed.
Thank you.
Any other questions or anything? Ron,
I do.
go ahead.
Hello?
Yes, go ahead.
I just want to commend the director on her use of horizontal management as opposed to just vertical management. Horizontal management styles, people have said in the past, oh, I use it. But at the end of the day, they're sort of like the great leader who makes it, everybody knows I better stay in line. A place like Graysdale, with so much going on, so much on the line, benefits greatly, I feel, from horizontal management style. And it seems to me that's what you're employing out there. So I commend that because I think ultimately we all want Graysdale to succeed. There might be some people that are still out there who want to sell Graysdale. That's going to be there forever and a day. It's not going to go away. So, the vast majority of people, including the local elected officials, I believe, still see the need for Graysdale, the importance of Graysdale, and we want it to succeed. And let me just say for myself, if I've asked any tough questions, or if there's a sense that, oh, I don't know if he really feels we're doing a great job, I do. I come from a generation where I didn't get a slice of orange if I did something well. Coach would say, rub dirt on it. But let me just say that I have spent all my time in county government supporting Graysdale, trying to help whatever way we can. And I'm also have said that if county funds are needed in a certain way, this idea of Graysdale paying for itself is a vestige of the 80s and early mid-90s. We may have to do that. And if I were still on council, I'd vote for it. So I want you to know that I appreciate the hard work all the staff are doing out there. And I like the management style you've described, and I wish you success.
Thank you.
I have some questions about the Talavera contract, because you mentioned it, but can you clarify a little bit more about what this rollout looks like? And you said it's off to a good start, you're getting ready for the next level. So could you
Yes.
clarify some of that?
Yeah, so the stage that we've completed is any long-term agency that have been with us for 500 or more hours have been converted to Talavera. And that's saving us a significant amount of money because Talavera's overhead is lower than other agencies. And right now, the biggest part we're working on with them is having their app communicate with our payroll and scheduling system. That's been our I guess I would say biggest challenge right now, because we need that communication to work. That way, whatever we have in our system that we say is an open shift shows up in their system so that their agency staff know they can pick up that shift. So we've been working closely with the county IT department on that. So that's very close. So that will help us greatly. And then they have been also recruiting new staff agency staff that haven't been with an agency with us before. And the importance of that is they've been recruiting local people because we were paying for a lot of travelers, which is a much higher rate. And some of the other agencies actually told us that that's all that was available were travelers. There weren't any local people. But we have been recruiting local people. So that's going to be a big help. So that will further lower their cost. So then the next step would be getting the MSP off the ground. And what that would entail is partnering with the other agencies where Talavera would continue to manage things for us because it's saving our staff, time and aggravation. But then they would be able to also come in, and it will also keep things at that same lower rate because any agencies participating in the MSP would have to agree to that is the rate. There's, not all these off rates that we had before. So again, keeping costs down. To me, I also think it kind of levels the playing field for us a little bit in the sense that, some of the agencies and the rates that we were paying, there was no chance for us to get a county employee because the rate that the agency was getting was so high that even if you say we have good benefits at the county, it's like, well, I don't need it with this pay rate because the pay rate is so much higher. I could buy those things on my own. So with lowering the agency rate, to me, it's a little bit more of a level playing field because if the rate is closer to ours, then you have a true, okay, is a little bit higher of a rate worth it and less benefits? Or, our rate and more benefits. So I think it's a closer matchup. So hopefully we'll see that difference, that it can help us convert and get county employees, because that's still our number one goal. We want county employees. And I should have added on here too that obviously the daycare opened. So we have children actually attending the daycare. Like, how could I forget that?
No, we knew, but that's.
I know, but it's still good to point out that the daycare did open.
Yes, it is.
Yes.
And it's still standing.
Yes. That was a huge.
How many folks are in there? How many little folks are in there?
I actually
That.
don't know the current number. I have to check. Do you know?
She'll figure it out. She can.
I don't know the exact number of children. I know that when we opened, we had somewhere right around 10 staff apply. Some of those folks had more than one child. Some of them are going to be after-school care. Some of them are anticipating summer care. So we've made sure that now all of Graysdale staff, even beyond the nursing staff, are understanding that they too can apply. And so, and then the biggest piece, I mean, that was the biggest piece. The second biggest piece is to be able to now actively use it for recruitment. So our contract with Kudu, that's what they're heavily focusing on now in terms of advertising that. So fingers crossed that that actually brings in some, some additional county employees in the next, over the next few months. I hope to have a positive report on that.
I have two quick questions. The child care is free for employees, correct? Because one of the women I work with has two kids under 3, and she pays $2,900 a month in childcare. I mean, that is that would be something, if I were a young nurse, I would be like, yeah, I'm going to work at Graysdale for 5 years so I could have my kids.
Yep.
You know what I mean? That would be a huge incentive. And then the other thing is, do you have the incentive of, if you say no to the benefits because maybe a husband or a wife has benefits and you get benefits already for your family, do you get a certain amount of money back if you decline?
You do, and I think Mary Lou would be able to answer that for sure, but I think that number's around $1,500. So it's not relative to the cost. It's better than nothing if you don't need the benefits, but it's not nearly equivalent to the benefits. And the daycare is absolutely free for staff at this point, and as long as we continue to have the funding, we will do that. And at some point, if that's not an option, then I think the county is going to be at least in a very good position to offer that at a very reduced rate, which is still a huge victory for for staff and for families, because yes, childcare is not only expensive, it's hard to find good childcare.
Well, that plus you have to drop your kid off and then
Correct.
go to work, and you have to leave super early, as opposed to your kid's right there.
Yep.
On the same campus. And are you using that as a recruitment tool
Oh,
at
absolutely, yes.
nursing schools?
Yes, so everywhere that we recruit, online, in person, social media, wherever, that is now a very top feature for sure. And for those who weren't able to come to the ribbon cutting, I mean, the daycare is, I mean, it's beautiful. It turned out amazing, and we're really proud of that. So it did feel like it was never going to open, and so it's sort of fitting that we both kind of forgot to mention that. But anyway.
And I would add that I think one of the reasons the numbers are low so far, why it's going to be more of a recruiting tool, is the staff members that have children already have them placed in a daycare. So, disrupting them in the middle of the school year. So I think definitely for recruiting is where we need to focus.
So back to the Televera questions that I was asking.
Yes.
What's your, maybe I guess I should say, short-term vision? Like, it sounds like the vision that you had by aligning with this group and being it is going the way you want. So what are your benchmarks, or what are you hoping for in terms of that? I mean, like, just hearing about the traveling nurses being reduced is music to my ears, but like reducing agency staffing by a certain percent, or what vision or goal do you have for this?
We do have a long-term goal of reducing agency staff, but in the short term, our goal is just to make sure that every shift is fully staffed, because we are struggling with that. And our PPD for September was 3.2, but that's the minimum, and that's our average for the month. So I don't think I have to say more about that. And you can see last month. So we need to have every shift fully staffed. We need it for our residents. We need it for our staff, because we have good staff that we don't want to burn out. But if they're working doubles or extra or a little short, like, we want every shift fully staffed. So that's our goal right now, is just let's get every shift fully staffed.
How are we doing with payments? Because I know years ago, again, we hired additional staff to make sure they're going after capturing every dollar, making sure you're getting everything. So again, with all of the changes governmentally, how are we doing? How are you feeling that we're doing with that? And are there any roadblocks with all of these government issues, or are we still on?
We have
I
some.
don't think it does affect parts of nursing.
There's been small parts that have been affected. So there's a document that we do that you document the residents' performance in their activities of daily living. And that documentation is key, and the interdisciplinary notes to show that we met as a team to discuss it. So we've occasionally lost some payment because of it not being what the insurance company wanted. So we're working on that.
You mean
That's
with
a key.
specific providers?
Yes.
Okay, but
Yeah.
not overall?
No,
just-
not overall. But we don't want to lose we don't want to lose a dime that we could have captured.
Absolutely. But what about Medicaid,
Lori?
Medicare? Yes, just a second, Ron. Medicaid, Medicare.
Medicaid, the big issue with Medicaid is, as it has always been, is the time lag of when someone gets approved and finally starting to get paid for them. So that hasn't changed. We still have that long backlog. And there's nothing that we on our end can do about that. That's on the state end. So that's a real burden.
Go ahead, Ron, sorry.
No, actually, you touched it. Given the government shutdown, I'm just wondering, and I really don't know, has your association, have they advised you on any concerns regarding Medicaid flow of funds? Because for us, it means everything.
Yeah, nothing has changed for us so far.
Okay.
And they're always so
they
far
don't
behind. That's
foresee
probably why we don't even notice right now. It's
No,
like, oh, it's typical for us.
Yeah. Okay. I was just wondering if this shutdown, because we have a two-phase shutdown now between the state and the feds,
Right.
if somehow that you were given to be concerned that could somehow, beyond the timeline, which I get, believe me, but that could somehow interfere in a much more, I don't want to say violent, but a much more stringent way with the flow of funds.
Yeah, I don't
you
think
haven't
it's
heard
anything we can predict on our ends at this point. We do participate in the PACA meeting so that, we get information from them, but we don't have anything specific yet that we have to worry about.
All right, thank you.
You're welcome.
Want to update? Sorry, I didn't speak into the mic like I was supposed to. I just appreciate the return of data, and not the return of the old data that I could not stand, but it's nice to get the snapshots. I do appreciate that.
Sure.
And it's nice to see the numbers where they are. And just from my perspective, well, I guess I'm going to piggyback and say something about Ron, because I don't know if we're going to have any other human services meetings this year, but it is not my intention, or I think anybody else on this council, to beat you up or anything. It's been a matter of getting communication and understanding. And yes, we did pay for a study, and so we'll make sure you get it, but you said you would give it to her. And it's not like it's the gospel according to affinity, it's just some information. So, but I appreciate what you're trying to do, but I also hope that you'll continue to tell us what you need to tell us so that we understand, because I don't ever look at it like bad Graysdale, no cookie. It's more like, how can we help you? How can we support you? But I hate that we're giving all this money to agency nurses and we can't do this. So again, if we're not using travel nurses, that's great. If we could start building back up, if you need to slow it down to build it back up better, I support that. To me, it seems like that IGT money is the big boogeyman. Like, if we cut back too far, we're going to lose it. But whatever you need to be successful, and it sounds like you're off to making it your own right now. So that's great. If you need anything from us, let us know.
Okay, thank you.
And are you planning to stay? I told a friend because there were nasty little rumors about you, so maybe we'll just let you clarify that, and so you could be public, or you could say no comment. If
Yeah,
you
no
so choose.
comment right now.
Thank you.
so.
But see, we asked the horse, and I just want to say, Ron Heckman is never, in his interesting way of presenting or asking information, trying to disparage anybody. That man has more experience than all of us put together in this room, in this industry, in this business. And so even though he says it a different way, I respect every stinking question he asks, and I hope you do too. Ron, I'm going to miss you like crazy next year. I think I'm going to ask you to call in as an expert in residence or emeritus. So thank you. Anything
You're
else,
welcome.
Ms.
I must say I don't
Wondolowski?
mind questions.
Just, I would like Mr. Heckman to know that Ms. Barbosa has already forwarded me the affinity report, and I have in turn already forwarded it to Michelle and Christina and Nicole, the Graysdale folks. So they already have it tonight, so thank you.
Try not to sit in the back. We appreciate that you are here. And Ms. Wondolowski, is there anything else before I adjourn as director that you want to update on us? Because I didn't put it on here, but maybe it crossed your desk or mine.
Nope, I think we've covered it well for tonight, and hopefully the new year brings some good news. Thank you.
If not, we'll be talking in December about how else we can help you. Thank